In this video, we'll be doing a full mock on a patient that is having ectopic pregnancy and is scheduled for surgery. It's going to be a full mock on APIE, that is the assessment, planning, implementation, and evaluation. Without further ado, let's get started. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dosum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? The reason why I'm here is to carry out a full set of observation on you prior to your scheduled surgery and ask you a few questions about your activities of daily living. Is it a convenient time, please? All right, thank you very much. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, so I have Janet James. Janet James. Your date of birth is 0101-1992, 0101-1992. Your hospital number is 1234567, 1234567. Perfect. And how may I address you, please? Oh, great. Janet is fine. Yeah, that's all right. Okay. Can I confirm if you have any allergies, please? Oh, bless you. And it's actually properly documented in my notes that you have no known allergy, and that is why you are wearing a white wristband. Right. Okay, so assessor, I can confirm I am with the right patient and I'm happy to proceed. So I'll be stepping aside to gather the equipment I'll be using for the procedure. Is that okay? All right, thank you. So leaving my patient bedside to gather my equipment, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm my equipment are calibrated, clean, and are ready for use? All right, thank you very much. All right, I'm back. Janet, are you happy for us to still continue? Oh, good. Right. So I'll be starting with a full set of observation now. Which of the arms would you prefer? Oh, good. The left arm. That's good. Right. Have you been resting in the last 20 minutes, please? All right. And I can see your legs are not crossed. Okay. So could you please confirm if you've had any surgery done on this arm prior now? Oh, good to know that. And I can see the arm is visibly clean. There is no skin lesion, no inflammation of any kind. So I'm happy to tie the cuff to your arm, occupying about 80% of your upper arm. I will make sure it is not too tight and it's not too loose. However, as soon as the machine starts working, you feel a little tightness around your arm. But do not bother, it's going to be for the time being. Is that okay? All right, so assessor, I can confirm I have the right size of cuff. Having tied the cuff on your arm now, I will not be starting the machine immediately. Is it okay to use your right hand, please? Right, so I'll be checking for your capillary refill. Right, so I'll be depressing your finger for 5 seconds to see how properly perfused you are. Checking the finger now, there is no form of inflammation, there is no forced nail, no nail varnish. Right. So I'm happy to depress your fingers for 5 seconds. 1, 2, 3, 4, 5. Yeah, I'm happy it returned in less than 2 seconds, meaning you're properly perfused. Right. So I'm happy to put the probe and I will start the blood pressure apparatus at the same time. Right. Your blood pressure is 95/65 and your SpO2 is 95%. So I'm going to be unwrapping the cuff from your arm as well as the pulse oximeter. I'll be cleaning the two as soon as I'm done. All right. So in the next 2 minutes, I want you to be silent. I will be silent as well. I will be checking your heart rate this time, and I don't want us to talk. Right. So is it okay to touch you? So I will go ahead now and palpate Janet's radial artery to check for the pulse. So assessor, my time starts now. So sorry, Janet, I actually checked your heart rate for 1 minute and your respiration for the remaining 1 minute. I was deliberate about not informing you so that the reading does not get altered. So sorry for this. Yeah, thank you very much. Moving on, Janet, this is an infrared thermometer. It is a device that is used to check temperature. It's not going to hurt you. It won't come directly in contact with your skin, neither. Right. Are you happy for me to go ahead, please? Okay, thank you. So looking at Janet's forehead, there is no excessive sweating, no skin lesion, no inflammation of any kind. I'm happy to check Janet's temperature. I have the temperature reading of 36.7. All right, Janet, we'll move on to A to E approach now. For your airway, which is the A, since the beginning of the procedure, you've been talking to me in complete sentences. I don't want to assume your airway is patent. To further establish this, could you please make a call for me? Good, good. Could you please take a deep breathing breath? Fantastic. So, assessor, I can confirm Janet's airway is patent. Moving on to B, which is the breathing. The other time I checked for your respiration, the rate and the depth. You have a respiratory rate of 22 cycles per minute. It is slightly elevated. You're having a total score of 2 on that. Do not worry. We are going to take care of everything and you will be fine again. Is that okay? Talking about the depth of the respiration, it is not too bad. It is still somewhat within the normal. Right. Talking about your SpO2, that is your oxygen saturation. You are saturating on air. However, your SpO2 reading is slightly subnormal at 95%. You're having a total score of 1 on that. Like I said, do not worry, everything is under control. All right. Moving on to respiratory noises, such as stridor, wheeze, or coughing. None of this was noticed during the assessment. I'm happy with that. Moving on to visual signs of respiratory distress, such as cyanosis, use of accessory muscles, excessive sweating, or breathlessness. None of these signs were identified during the assessment. I'm happy with that. Right, moving on to your circulation. The other time I checked for your capillary refill to see how properly perfused you are. After depressing your fingers for 5 seconds, your capillary refilled in less than 2 seconds, meaning you're properly perfused. And I'm happy with that reading. Looking at your upper and lower extremities, there is no peripheral cyanosis, meaning your circulation is optimal. I checked your blood pressure. You have a systolic reading of 95/65. That gives you a score of 2. Do not worry, we'll take care of that. Also, your pulse rate is 112. You are having a score of 2 on that as well. So moving on to D, which is the disability. Do you know where you are at the moment? Good, you're actually in the hospital. Yeah. Do you by chance know what time of the day it is? Great, it is actually a noon time. Well done, Janet. Do you know who I am? Great, I am your nurse. Fantastic. Assessor, could you please confirm the last time Janet's blood glucose level was checked and what the reading was? Great, it was checked at early hour of today and is within normal therapeutic range. So I'm happy to hear that, Janet. Right. Okay, so can I confirm if you visited the loo today? Oh, great. About an hour ago. Fantastic. Do you experience any pain while miturating? Oh, good. Not at all. I'm glad to hear that. Right. Are you in any form of discomfort or pain at the moment? Oh, so sorry to hear that. So sorry, Janet. On the scale of 0 to 10, 0 being no pain and 10 being the worst pain possible. How would you rate your pain, please? Oh, so sorry to hear this. You would say 7. That is quite high. Assessor, Janet seems to be in a lot of pain at the moment. If it were to be real clinical settings, I would have loved to stop whatever I'm doing at the moment and attend to Janet. But for the purpose of the exam, could you please allow me to continue? All right, thank you very much. So sorry, Janet. Can I reposition you? Could you please tell me exactly where the pain is? Oh, so sorry. On your tummy. Is it okay to support you with this pillow? Oh, so sorry. Can I support your back also with pillows? So sorry. So sorry. All right. Have you had any analgesia recently? Oh, you haven't. I'm going to be checking through your match chart in a moment to see if you are due for any. And if not, I'm going to be escalating your care. And as soon as analgesia is prescribed, I'm going to come back to administer the medications to you. Is that okay? Oh, so sorry to hear this. I know how discomforting this time may be. So sorry. All right. Are you still happy for me to continue? All right. Can you manage? All right. Thank you very much, Janet. I'll be as quick as possible. Moving on to E, which is the exposure. The other time I checked your temperature, it was quite normal. I'm happy with the rate. It was 36.7. It's within normal therapeutic range, and I'm happy with that. Right. On the part that is exposed on your body, I cannot see any signs of bruises, bleed, or injuries. Could you please confirm if any part of your body that is covered, if there is any of these signs? Oh, none at all. All right, thank you very much. I'm glad to hear that. Right. A quick one on your past medical history, Janet. All right. So I have reviewed your past medical history, and you have no significant chronic illnesses, no prior abdominal surgeries, and you have no known allergies. Yeah. Obstetric history include one previous miscarriage. Is that correct? Oh, so sorry to hear this. Right. And you are not on any regular medications. Is that true? Oh, thank you for confirming that. Right. Can I confirm if you are currently taking any over the counter medicine? Oh, thank you for intimating me with that information. And what of herbal remedies or contraceptive? Oh, none of this. Okay, I'm glad to hear this from you, Janet. All right. So I'll be stepping aside to quickly put together every of my assessments and come back to relay my findings with you. Is that okay, Janet? All right. Thank you very much. So stepping aside to document my findings, I will perform my hand hygiene following the 7 steps of WHO standard. Yeah, I'm back. Yeah, are you still comfortable? Okay. So, following your assessment, I came up with a total new score of 7. It is not to frighten you. It is just because of your situation, your condition now makes us to come about this score, and it requires urgent care. I will be escalating your care to the medical team because it requires urgent attention. So they will be here to arrange for your surgery as quick as possible. Right. Is that okay? Okay. So there is nothing to worry about at all. Right. So a quick one about your activities of daily living. Okay. So how do you mobilize generally? Oh, I'm glad to hear that. You mobilize independently. Oh, good to know. So, regarding your psychosocial, Janet, I could see you live with your husband and your 2-year-old child. Is that correct? You work as an office administrator and you have good family support. Good to know that. That's good. Yeah, well done. Yeah, and you have no history of smoking, but it is documented that you drink socially. Oh, are you planning to quit anytime soon? Okay, so with your permission, is it okay to refer you to Alcohol Anonymous Group? Okay, so after your surgery and before your discharge, this was going to be arranged. So I'm going to be noting it and I'll be escalating appropriately. Is that okay? So how about your sleeping pattern? Oh, so sorry to hear this. You've not been sleeping all right because you are anxious of the surgery. Do not worry. The facility is well equipped and will have competent ends. You are in safe hands. Do not worry, okay? So, pending the time the surgery is going to be carried out, I would just want to encourage you. You should see your favorite movies, okay? Then read novels, right? Is that okay? So this will channel your mind away from every worries. Is that all right? Also, you take relaxation techniques such as deep breathing exercises. This is known to allay worries. All right? Do be willing to do this, Janet. And if you want, with your permission, we can as well refer you to psychotherapy team for proper plan of care. Is that okay? All right. Thank you very much, Janet. Right. So, has anybody come to you to um, talk to you about what the surgical procedure entails? Oh, great. Somebody, a colleague has come to you to tell you the risk and the benefits as well as the outcome of the surgery. All right. That's good to know. About your spirituality, do you practice any religion at all? Oh, you don't and you don't want to. That's quite understandable. There is nothing to worry about, Janet. That's fine. Right. Do you want to tell me anything about your sexual life? Oh, I quite understand. There is no problem at all. You don't want to discuss that. That's good also. There is no problem. So apart from all of this we have addressed, Janet, is there any other thing you would want me to know? Oh, thank you very much. All right, there is no question, and I've been of great help to you. I'm glad to hear this. Thank you very much, Janet. All right, so here is the call bell. Should you need me, we'll be coming, like I said, to monitor you. Like the frequency of monitor would now be like 15 minutes thereabouts. All right, because it's your case requires urgent attention, and your surgical procedure will be arranged for as soon as possible. All right, okay, so I will be back, like I said. So here is the call bell. Thank you very much. So leaving Janet now, I will be cleaning the used equipment in preparation for the next use, and I will go ahead to perform my final hand hygiene, following the 7 steps of WHO standard. All right, colleagues, that's as simple as that. That brings us to the end of the assessment station. I will see you shortly in planning station. Stay tuned. That was quite hot. Yes, it was hot. Yes. So I came up with two nursing care plan with one extra care plan. So in case in your exam, you will be equipped with enough, even more than enough care plan to write on. Right. So the first nursing care plan for a patient that is scheduled for surgery is obviously it is not a problem, it is a need. This patient requires safe surgery preparation. It is not a problem, you know that. Yeah, it is a need. So it could be a need. You see on that space, it is either nursing problem slash need. So anyhow, it's fine. Okay. In case there is nothing significant to write to plan this patient on and is scheduled for surgery, safe surgery preparation is a good care plan to write on. Right. So the nursing need is Janet requires safe surgery preparation. It's as simple as that. You don't need to evidence it. You don't need to say due to, no. It could be that simple. Yeah. The aim of care is Janet will be safely prepared for surgery, preventing complications and promote a positive surgical outcomes. Yeah, right. Your reevaluation date is today. Your exam date in bracket open and close. Continuous monitoring is required as the patient condition seems deteriorating. Remember, during the assessment, when we checked this patient, the patient was having a total new score of 7. Yeah, it requires urgent attention, a continuous monitoring. So you are going to refer to that in this case, right? So Immaterial, like I often say, it is your surest plug. You can't negotiate that. Yeah. The first letter is E. You will explain and discuss all aspects of care to Janet and obtain informed consent. Good. You monitor and record Janet's vital observation like every 15 minutes, at most 15 minutes, and escalate as per news 2 policy. Yeah. The next letter is assess. Assess Janet for venous thromboembolism risk and provide anti-embolic socks. Next, you educate Janet on the procedure, risk and benefit, as well as the expected outcomes. It is very important. Next, you should ensure required lab investigations and results are available, such as blood grouping and cross-match, coagulation profile, among others. You should also educate Janet on pre-operative fasting, that is, nothing per hora, 6 to 8 hours for solids and 2 to 4 hours for clear fluids. Next is A. You administer pre-operative medications if appropriate. If appropriate, especially to ease anxiety, monitor effectiveness and side effects after 30 minutes. The next one is R, which is referral. Refer Janet to surgeon or surgical team for clarification on procedure. Next, you demonstrate and inform Janet on the use of cowbell. Document all care as planned. You have successfully completed the first nursing care plan. Moving on to the second nursing care plan, remember during the assessment this patient was in severe pain, yeah, of about 7 out of 10. That's quite severe. So it is a good nursing care plan to plan this patient that is going for surgery on, except stated otherwise, but it is a good nursing care plan. Yeah. The nursing problem is Janet is experiencing abdominal pain due to ectopic pregnancy with a pain score of 7/10. That is simple and straight. Your aim of care is Janet will verbalize relief of pain between 0 to 3 out of 10 following nursing interventions. And your reevaluation time and date is today, your exam date in bracket open and close, very essential. Yeah. And because Janet's case is peculiar and it requires continuous monitoring, it will not be up to the usual 30 minutes. So you should monitor this patient every 15 minutes, at most 15 minutes. Yeah, or sooner if the clinical condition changes. Immaterial is still what we are going to use. Explain and discuss all aspects of care to Janet and obtain informed consent. Monitor and document Janet's vital observations every 15 minutes or continuously as stated earlier, and escalate as per news 2 policy. The next is assess. Assess Janet's pain level using pain assessment tool. The next is teach. Teach Janet on relaxation techniques such as deep breathing exercise. This will ease Janet of any discomfort. Also, teach Janet on diversional therapy such as watching his favorite movies or reading novels. This will channel Janet's mind away from the pain. Alright, so having said that, the next thing you do is you should administer the due medications if not contraindicated in the case of Janet. Monitor effectiveness as well as side effects every 30 minutes. Having said this, the next letter is referral, that is R. Refer Janet to the surgical team for proper clarification or for proper management of pain. Right. The next one is demonstrate and inform Janet on the proper use of cowbell. Lastly, on that note is you document, make sure you document all care as planned. You have successfully written the second care plan. Simple, isn't it? Yeah. Moving on to the bonus I promised earlier, it is Janet is experiencing anxiety due to unknown outcome of the surgical procedure. Yes, this is valid and it could be anyone. For a patient that is scheduled for surgery, it is normal, absolutely normal for the patient to be experiencing anxiety. Yeah, so it is a good care plan to plan this patient that is scheduled for surgery on. Right. And what is your aim of care? Janet will remain calm following nursing interventions. Right. Or the anxiety level is going to be relieved. Right. Anyhow you want to put it, that is your aim of care. Your aim of care is what you want to achieve after your interventions for the patient. Okay, your reevaluation time and date is today. Your exam date in bracket open and immaterial is still your surest best plug here. Right, explain and discuss all aspects of care to Janet and obtain informed consent. Next, you monitor and record Janet's vital observations every 15 minutes or continuously, just like we have earlier mentioned. Okay, and escalate as per news 2 policy. The next alphabet, which is A, that is assess. You assess Janet for signs of fear, worries, or distress, such as trembling, sweating, tachycardia, or nausea. Using open-ended questions such as what is your major concern about the surgery? The patient is going to be expressive enough for you to know how to help such patient. You assess Janet's knowledge about the procedure, asking if anyone has come to explain clearly about everything that the procedure entails. Alright, then ask if they need anything to be clarified on. Here, you need to adopt active listening by giving them time to talk. You give Janet time to talk and listen to their concern. Also, you reassure appropriately. So the next thing is teach. You teach Janet relaxation technique such as deep breathing exercise. This will lessen Janet's worry. Right. Educate patients on the procedure in a clearer and simple terms. Avoid jargons, because when you start speaking jargons, it will instill so much fear in the patient and that can further complicate the matter. Right. Offer Janet your presence. Many patients, if they see the healthcare personnel around constantly reassuring them, it makes things to appear a way easier for them. So you need to stay within this patient in order for the patient to stay calm as much as possible. Next is referral. You can refer Janet to a counselor or surgical team for further clarification on the procedure. Because when they say, okay, this is the surgeon that is going to be attending to you, it will make them to want to outpour their mind the more in order to be clarified on whatever point that may seem not clear to them. Yeah. The next one is administer all due medications if not contraindicated. Remember, this patient is scheduled to go for surgery. So if appropriate, administer due medications. The next one is demonstrate and inform Janet on the appropriate use of call bell. Lastly, on that note, document all care as planned. You have successfully written the third care plan. So out of these three, you will have at least one to use in your exam. All right. This being said, I hope you've learned one or two things. I will see you shortly in the implementation station. Stay tuned. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm overlap the thumb, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? Right. So the reason why I'm here is to administer your pre-operative medication that is due at 1200 hour. Is it a convenient time, please? Okay, thank you very much. Before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, so I have Janet James. Janet James. Your date of birth is 0101 1992, 0101 1992. Your hospital number is 1234567. 1234567. Perfect. How may I address you, please? Good. Right, Janet. Right. So, assessor, I can confirm I am with the right patient and I'm happy to proceed. All right, Janet, could you please confirm if you are allergic to anything at all? Oh, good. It is properly documented here that you have no known allergy, and that is why you are on white wristband. All right. So, is it okay to take you through your medication record chart, Janet? Oh, good. Thank you. I have the hospital MA chart for Janet James. The date of birth is 0101 1992. The address is 27 Doubting Grove, Badley Green. The ward is female ward. The date of admission is today. The height is 1.57. The weight is 74. The body mass index is 25.6. The consultant's name is Dr. Tolu. The time of admission is 1000 hour. On the page where the prescriber details is to be written, I have the name Dr. Tolu, GMC number 1234. The signature is properly appended. The blip number is 642. Moving on to the page where the details of the person administering the medication is, which is me. I will be coming back to document on this page appropriately. Moving on, under alert and allergies, there is no allergies for Janet, and the box no is ticked because Janet have no known allergy. Moving on to medication risk factors, there is no medication risk factors tick for Janet. I move on to the next page. I still have hospital MA chart for Janet James. The date of birth is 0101 1992. The rest of information on this page is as the same as the previous. I've read and understood the code. I'll be making proper use of it if need be. Moving on to once only medicine. The date is today. The drug is co-amoxiclav. The dose is 1.2 gram. The route is IV. The time required was 1000 hour. The prescriber signature and blip number is properly documented. It is a valid and legible prescription. It was given by a senior colleague at 10:30. Moving on to the next page, I still have hospital MA chart for Janet James. The date of birth 0101 1992. The rest of information on this chart is as the same as the previous pages. Under prescribed oxygen, there is no prescribed oxygen for Janet, and Janet is not retaining CO2. So the box no is ticked for Janet. I will move on to the next page. I still have hospital MA chart for Janet James. The date of birth 0101 1992. The rest of information on this page is as the same as previous. Under antimicrobial, there is no antimicrobial prescribed for Janet. I will move on to the next page. I still have hospital MA chart for Janet James. The date of birth is 0101 1992. The rest of information on this page is as the same as the previous. Under regular medicine, there is no regular medicine prescribed for Janet. I move on to the next page. I still have hospital MA chart for Janet James. The date of birth is 0101 1992. The rest of information on this page is as the same as the previous pages. Under as required medicine, I have the drug paracetamol. The date is today. The dose is 1 gram. The frequency is 4 to 6 hourly. The route is per oral. The duration is continuous. The start date is today. The finish date is continuous. The prescriber's signature and blip is properly documented. It is a valid and legible prescription. All right, Janet, can I confirm if you are still in any form of pain? Oh, so sorry to hear this. On the scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, please? Oh, so sorry to hear this. You will still say 7. Oh, so sorry. You are due for analgesia now, and it has not been previously administered to you. Alright. So what paracetamol does is, it is a medication that relieves pain. Alright. And some of the side effects you may or may likely not to manifest include and not limited to nausea, vomiting, or abdominal discomfort. Are you still happy for me to administer this medication? Alright, thank you. So I will not be appending my signature now. I will come back to do that as soon as I'm done administering the medication. Moving on, still under as required medication, I have ondansetron. The date is today. The dose is 4 mg. The frequency is 3 times daily as required. The start date is today. The finish date is not stated. The prescriber signature and blip is properly documented. The route is IV. The duration is not stated. The time is 1200 hour, which is my time. It is a valid and legible prescription. Ondansetron, it's a medication that is used to prevent nausea and vomiting. However, I am not going to be administering these medications to you, Janet, because I am not certified yet to administer intravenous medications. So I'm going to be escalating this so that the senior nurses can come and administer this medication as soon as possible. Alright. I will not be coding the medication because I'm not giving. It is under as required page. Right. So I move on to the next page. I still have hospital chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as previous. Under infusion, the date is today. The infusion name and strength is 0.9% normal saline. The volume is 1,000 ml. The route is IV. The rate is 250 ml. The prescriber signature is properly appended, pharmacy checked, documented. It was given by a colleague, a senior colleague, Roy. The start time was 1100 hour. It's still ongoing. To stop by 1500 hour. Alright. Do you feel any pain around your cannula site as I'm touching it, Janet? Oh, even as I'm touching it, there is no palpable venous cord. Right. And the other time I checked your temperature, it was not high, meaning you are not having any fever. There is no redness and there is no swelling, meaning the cannula is healthy. Right. So the infusion can still continue to run. Right. The last part of the page, which is where the omitted medication is to be documented, I will be coming to document appropriately if need be. Alright. So I'll be stepping aside now, Janet. Here is the call bell. Should you need me, press on the call bell and I'll be here to attend to you. So leaving Janet now to prepare the medications, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. So I have on my hand paracetamol. The stock dose is 500 mg. It is not expired. The expiration date is February 2026. I'm happy to administer. Before I administer, I will go ahead to compare that with the prescription I have to be sure it's the same medication. So I have on my hand paracetamol and on my prescription is paracetamol. 1 gram is prescribed, 500 mg is the stock dose. It does mean I'm going to be dispensing 2 tablets from the bottle. Right. So it's going to be in an aseptic manner. From the container, I will carefully dispense 2 tablets to the lid, making sure my hand does not contaminate it, and I will carefully transfer it to the pot. I will go ahead and secure the lid back to the bottle. Right. So prior every medication administration, the 6 rights of medication administration principles need to be ensured. That is, the right patient, the right medication, the right route, the right time and date, the right documentation, as well as the validity of the prescription. So I have the 6 rights. and I'm happy to proceed. Since paracetamol is the only medication I have and I've dispensed it, so I will go back to my patient now to administer the medications. Leaving for my patient bedside, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. Right, I'm back. Are you still happy for us to continue, please? Thank you very much. Right, before we continue, could you please to reconfirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? Yeah, I still have Janet James. Janet James. Your date of birth is 0101 1992, 0101 1992, and your hospital number is 1234567, 1234567. Perfect. I can still confirm I am with the right patient. Right. You said the other time that you are not allergic to anything. Is that okay? Yes, it's still properly documented here with the evidence of white wristband on you. Right. So I'm happy to proceed. Could you please confirm with me, Janet, if you have any difficulty swallowing at all? Fantastic. Do you have any nausea at the moment? Great. So how would you love your medication to be served? Is it with water or squash? Good. So have a cup of water here. Would you want to take the medications first or the water first? Oh, water first. Here you go. Good. And here is your medication. Fantastic. Thank you very much. Could you please confirm you have taken the medication by opening your mouth? Great. So, assessor, I can confirm Janet has safely taken her medication. So, I can proceed to document. Yeah. Thank you, Janet. Here is the call bell. Right. I'll be stepping aside now to quickly document what I've administered to you, and I'll be back in a moment. Right. So leaving Janet bedside, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, thank you very much. I'll still be around you for, let's say, 30 minutes. So after I might have left, you just ring the buzzer anytime and one of the member of the team will come to attend to you. Is that okay? Right. Thank you very much. So I'm going to be locking the medication cupboard and return the key back to the place of safety. Then I will clean the pot I've used in preparation for the next use. Okay, so I'll go ahead now and perform my final hand hygiene following the 7 steps of WHO standard. It's as simple as that, colleagues. So I will see you shortly in the evaluation station where we are going to be handling over this patient. Yeah, stay tuned. So for the situation, I am Kenny. I'm handling over James, a 33-year-old female admitted with a confirmed diagnosis of ectopic pregnancy. She's scheduled for emergency surgery today. For the background, Janet presented with lower abdominal pain and vaginal bleeding. A positive pregnancy test and transvaginal ultrasound confirmed an ectopic pregnancy. Preoperative preparation has been completed. She has been nil per mouth for 6 hours. She has no significant past medical history, no allergies, and not on any regular medications. Socially, Janet lives with her husband and their 2-year-old child, works as an office administrator, and has good family support. She has no history of smoking, however, she drinks socially. She is normally independent with daily activities. Upon Janet's initial assessment, she had a total NIL score of 7, showing signs of mild shock, that is, tachycardia, low blood pressure, and mild hypoxia, and was monitored continuously as a matter of urgency. Moving on to the assessment. The most recent assessment for Janet is as follows. Temperature 37.2 degree, pulse 108 beats per minute, respiration 22 cycles per minute, blood pressure 102/68, SpO2 96%, a total NIL score of 4, which is still moderate risk. Vital signs have improved but remain slightly unstable. Pulse still elevated, blood pressure on low side still. NIL score decreased from 7 to 4, indicating some clinical improvement. Upon Janet's initial assessment, two nursing needs were identified. The first one was that Janet required safe surgery preparation. She was assessed for venous thromboembolism risk and provided with anti-embolic socks. She was educated on the procedure, the risk and the benefits, as well as the expected outcomes. Lab investigations such as blood grouping and cross-match, also coagulation profile, was reviewed. Pre-operative medications were administered, except for ondansetron, which was not administered because the nurse was not licensed to give IV medication. The side effects and the effect of the rest of the medications administered were monitored after 30 minutes. Also, Janet was referred to surgical team for further clarification on the procedure. The second nursing need that was identified is that Janet was experiencing abdominal pain due to ectopic pregnancy. With a pain score of 7 out of 10, her pain level was assessed using pain assessment tool. She was taught relaxation techniques such as deep breathing exercise and diversional therapy such as watching movies and reading novels. Janet was referred to pain assessment team for further plan of care. Due medications were administered. The effect and the side effects were monitored. My recommendation: I would recommend continuous monitoring of Janet vital observation every hour pre-operatively according to the most recent NILS score of 4. As stated earlier that ondansetron 4 mg was not administered due to the nurse not qualified to give IV medications, I would recommend it reviewed and administered for the prevention of nausea and vomiting. Janet is prepared and ready for theatre. That will be all from my end. Do you have any questions for me? Thank you very much. Should you require any further information, do not hesitate to contact us and we will be happy to attend to you. Thank you very much. All right, colleagues, it could be that simple. That brings us to the end of the full mock for an ectopic pregnancy who is scheduled for surgery. Yes, if you require assistance on how to properly prepare for your OSCE, I'm just a call away. Contact us through the number on your screen and we will render help to you in a little way we can do. Thank you so much. I will see you in my subsequent videos. And until then, keep practicing OSCE. You've got this. You are already a success. Bye.